name's Amy Navejas. I'm the Executive Director at the North Carolina Down Syndrome Alliance. I want to thank all of you for joining and participating. I know nighttime can be challenging, especially with our kiddos, but thank you for taking the time to be here for this really important information. Wanted to go over a couple different things real quick for housekeeping. We welcome you. This is a hosted collaboration with the other Down Syndrome Alliances in North Carolina, including Coastal Buds, Down Syndrome of Onslow and Carteret Counties, Greater Greensboro, Greater Winston-Salem, Greater Charlotte, and the High Country Buddy Walk. So we thank you all for your patience. If we have any technology glitches, so far so good, so knock on wood. But barring any issues, then we are going to record this and we'll have that available to you all later. I also wanted to mention that for your questions, the chat is open, but we are not going to be monitoring those tonight. What will happen is you'll get a link separately where we will ask you to submit your questions, and at next month's Q&A session, those questions will be addressed. So again, don't put those in the chat session. Those will not be monitored and saved tonight. You're going to want to do that in the separate link that will be sent out to you by NCDSA staff. Okay. Also, want to introduce and thank our wonderful speakers tonight. We have the topic Making Sense of North Carolina Medicaid Plans, Services, and Waivers, and it's presented by Neva Bartholomew, MD, NPH, and Allison Crotty, MSW, LCSW. So we want to thank both of you for being here with us and sharing all of your knowledge and expertise, and I will hand it over to you to take it from there.
Thank you, everyone. Thanks for having us both. I'm going to get us started, and I am Dr. Neva Bartholomew. Are you going to be moving the slides, Allison? I should have asked you that. Or should I? Yeah, there you go. Thank you. That's our names and our titles. We both work for Partners Health Management. We're going to tell you a whole lot more about Partners as we go forward. Next slide, thanks. So this is me, a little bit more about me. I am all my life Tar Heel, went to college, med school, public health school, and did all my residency here, and I still live in Chapel Hill, so I clearly can't get away. I am a primary care doc. I did a family medicine residency at UNC, but I have spent most of my career working with what I call the most vulnerable populations in the state. A great deal of time I spent at Central Regional Psychiatric Hospital, which is one of our state hospitals. I spent 2 years working for the state prisons during COVID. And now for the last 2+ years, I've been the Deputy Chief Medical Officer for Physical Health at Partners. But the role that I'm probably most proud of is that I am wife, mom, and caretaker to 2 girls. That's my daughters. The one on the left, her name is Meg. My other daughter is Eden. She's the one in the front of the car. They are currently, this was taken a few years ago, but they are currently 23 and 20. My older daughter had just learned to drive when we took this picture, and my younger daughter in the back is obsessed with riding in the car. So this was a really happy time for both people. My younger daughter, Meg, has a rare genetic syndrome that we did not get diagnosed till she was 13, but it causes autism, epilepsy, and severe developmental delays. So I have a kinship with you all in that way, and understand from my own personal life what it's like to live in this world and how dang confusing it could be. So we're here to talk to you about that and help you make sense of things that sometimes seem impossible to make sense of. So I'm going to hand it over to Allison and let her tell you about herself. Thanks.
Okay. Good evening, everybody. It's nice to spend some time with you tonight. So I was Maryland born, but I've been here in North Carolina since 1982. And I started my career as a middle school teacher. And then that was in my 20s. And then I had a child who had special needs, and that took me in a whole different direction. I was hungry for information, and I still am. And I didn't know what the future had in store, and there was no diagnosis that I had for my daughter. So back in Charlotte in the early years, there weren't a lot of support groups, but I went and attended a Down Syndrome Association support group just to get some information, and then later started a support group. So, and I've worked in the neonatal unit to try to help families get the resources they need. And I'm still doing that in my current role at Partners. I've been working in managed care since 2010. I've been in private practice and had a ABA specialist who worked with me. So all along my career, trying to help people get the resources they need. So I'm going to share a picture of my daughter, Samantha, who is now 31, and my son, who is 29, and she loves her brother more than anything. And I don't know, Raggedy Ann's really close second. So Raggedy Ann, she had Raggedy Ann and Andy since birth. And thank goodness you can still get these dolls, because one lasted about 28 years until a dog destroyed what was left of it. And anyway, we have a whole family of Raggedy Anns now, and it's the only thing that Samantha has ever attached herself to. So I'm just blessed to have that for her. So you can see that we've kind of been through the walk, and you know, we really want to show you a peek inside and help you find where to go. Try to explain a little bit about what is so complicated in this world of services, waivers, managed care, and tailored plan, and all of that kind of stuff. All right, so, and this is just some of the topics that we're going to cover, and we have a lot to cover. So we'll just go ahead and get started. So we both work for Partners Health Management, which is one of the four managed LMEMCOs, which is a local management entity managed care organization. So you can see the counties. There are 15 counties that we serve. Davidson County just joined us. And we'll talk a little bit about that, but it doesn't matter what LMEMCO you're with or what tailored plan soon to be. We try to keep the information generic so that you'll know who to contact with your LMEMCO in this presentation. All right, so let's start at the beginning with Medicaid that funds a lot of these services. And Medicaid is a state and federal government financed health insurance program. So just like any insurance, whether it's Blue Cross or this or that, Medicaid covers medical bills, all types of services that we have. What's interesting is every state has a different array of Medicaid services. So the federal government gives states money and says you have to have emergency services and you have to have outpatient services, but the rest of it, each state comes up with their own menu. So we are lucky in North Carolina that we have a very broad menu of services. But the downside of that is it can be a little confusing to access those services and know which ones they are. So, but always where to go for Medicaid services is the LMEMCO, and that's the first place to start. And they all have call centers, member services for you to reach out to. So we are getting ready for a new transformation of Medicaid, managed care. So managed care is not new, believe it or not. We've been doing that for quite some time. We had care management through CCNC that brought in managed care, first of all. Then in 2012, after a pilot, they took behavioral health Medicaid into managed care. So you've already lived through that transformation. And the newest one is with the standard plans and the tailored plans that we'll go into more information about that. So each state, through Centers for Medicare and Medicaid Services, applies for different waivers for you all to receive different services on that menu in each state. And we have been managing the 1915 BC waiver, and now it's the I waiver. and we still have some of the BC services. So CMS.gov waivers has a lot of information about the different waivers, and we'll go into a little bit about that as well. So Medicaid services are the same across all health plans. They are determined by the state of North Carolina, and they have clinical coverage policies for each of those services. The only thing that's different among some of the plans are some added benefits and what we call in lieu of services. So there are just a few tweaks to that Medicaid menu that we're talking about. So Medicaid did expand in December of last year, and this was a monumental thing. So most states have expanded Medicaid. We get extra federal funding. And what has changed greatly about it, not just increasing the income limits, but allowing more groups of people to be able to get Medicaid. Before, you had to either have children or you had to be under the age of 18. And now the income is raised, and adults 19 through 64 may be eligible for that expanded Medicaid. They can have a little bit more income. They've raised that income level. So it is worthwhile for people to check and see. And these are some links that you can look at later when you get this slide deck. So how to apply for Medicaid. They have expanded it to make it easier for people. There is an electronic e-pass system that is very helpful for people to avoid waiting locally, to get appointments, waiting on appointments. So most of this can be done online now. If you are a guardian, there are some extra steps to that. So if you ever have issues, I'll have my contact information and you're free to reach out to me. My team has tried and tested that, and we can help you weed through some of that barrier for guardians using the e-pass system. But once you're in there, it's really easy, and you can update your child's information and make changes to your Medicaid at that point. So e-pass is one way. The old-fashioned way is going to your county DSS. And then a third new way that's opened up is that federal marketplace, healthcare.gov. You can apply to get coverage through that Affordable Care Act, and they will also check to see if you're eligible for Medicaid through that system. So it seems like a good place to start to me is to go through there, and they will flag you if you meet the criteria for the expanded Medicaid. And you do have to be mindful of the open enrollment periods, but anytime something changes, maybe you lost your employer insurance or any other type of qualifying enrollment reason, then you can do that anytime and not just through that. So there are, even if you don't meet requirements for Medicaid, you may meet the requirements to have a very reduced fee for the Affordable Care coverage for insurance. And sometimes people, even if their child has Medicaid, they may have another insurance that is the first payer. And so that can help too. All right, so this is more about the healthcare coverage. I'm going to kind of go through this. Am I hitting the wrong one? There we go. Another insurance is Medicare. So generally it's for people 65 and older, but sometimes there are other reasons that people may get Medicare. And as our children are aging, they may, depending on a condition or maybe a parent retires or some other reason, they may then get Medicare and Medicaid together. So Medicare is always the first payer for any services, and then Medicaid is always the last payer of resort. So something to consider with that. Medicare, if you do ever have questions about that, a non-biased, wonderful program is the SHIP program for senior health insurance information. And they are usually with the Department of Aging in your area. And you can call and make appointments. Most of them are volunteers and they are well versed. There's extra help to help with maybe the Medicare Part D and that type of thing. There are some nuances for eligibility for some of the different plans if you have Medicare and Medicaid, and we'll talk about that a little bit later. And there is a general movement sometimes when people get Medicare and Medicaid and they're on the innovations waiver, there are some caveats with some spend downs. And, just this SHIP office can help you with those things. And care managers that we'll talk about can also help you. Other ways to get benefits, Medicaid and income. There is the supplemental security income. And so understanding that this is based on eligibility and depending on the situation, income matters, but many times income matters with this. But this is not tied to employment and any money that you've put into the system. So this is based on disability. So for adults and for children. And something very, if your child's under the age of 18, they may not qualify because of the age, but before they turn 18, that's something that you want to apply for with Social Security Administration, depending on what their birth date is, because once they're 18, they become a household of one, and then they only look at their income. So it's a very timely process. So something to consider with that. And Social Security Disability is more tied to what you've paid into the system when you have a disability that you're unable to work based on that. So this is on work history, so that's different.
So
Go
next
ahead.
we're gonna go into the various types of health plans that Medicaid has in North Carolina and the one that is coming very soon on July 1st as well. So Medicaid, as Allison mentioned, is now moving towards total managed care. It started in 2021 with the standard plans, and we're going to talk more about that. But we are adding another plan called the Taylor Plan very soon. You can go to the next slide. Thank you. This is just a link for you to check out later if you're interested in reading more about this in more great detail. Next slide. I'm a visual person, so I really like this slide to try to explain Medicaid. Medicaid starts out with at least half of the dollars for Medicaid money in North Carolina coming from the federal government. So that federal money comes from what we call the Centers for Medicare and Medicaid. It's a federal agency, and they give us at least half, depending on the services provided, of the money that goes to North Carolina Medicaid. Then the state here, the North Carolina Department of Health and Human Services, takes that money and adds state money to it and helps manage the money by giving some of it to standard plans, which we're going to talk about. That's for a certain population in North Carolina. And the rest goes to LME MCOs, which, as Allison explained, there are 4 of, and Partners is one of them. What the LME MCOs do with that money is part of it goes right now to the Medicaid Direct Plan. The Medicaid Direct Plan is what LME MCOs have been doing for several years now. They're managing the behavioral health and special services around intellectual and developmental disabilities, mental health services, TBI, which is traumatic brain injury. They're managing those services only. The physical health and the pharmacy needs of that population are still going through the state Medicaid fee for service, so they are not being managed for this population. Soon, Part of the people in Medicaid Direct will move into something called the tailored plan. The tailored plan will be run by the LME MCOs, which is us and the other 3 in the state. And the difference will be that in addition to doing the behavioral health and the IDD and the TBI services, we will also begin to manage the services of physical health and pharmacy for that same population. And we'll talk a little more about who that population is next. Well, we won't. This is the one after this one. So just going one more time into current state right now is just Medicaid Direct and standard plans. This is standard plans. 2 million Medicaid beneficiaries are currently enrolled in standard plans. It's about 75% of the people getting Medicaid right now. There are 5 of them across the state. If you had a standard plan, if you were enrolled in a standard Medicaid plan, you would have your choice of these 5. All of them are available all over the state except for Carolina Complete Health is only available in 3, 4, and 5. So almost everybody has all 5 as an option. I think Region 1 and Region 2 don't have CCH or Carolina Complete Health as an option. Next slide. Yep. So what is Medicaid Direct? Again, this is a healthcare program that is for people who are not enrolled currently in the standard plan. You can see any healthcare provider they want who accepts Medicaid. That medical office will bill North Carolina Medicaid directly. This is what's happening. And they may get tailored care management with an LME MCO or a care management agency in the community. We'll talk a lot more about what that means later. Next slide. There's also another plan to be aware of. If you are part of a federally qualified tribe, Indian tribe, you could qualify for the tribal option, which is a separate managed care plan simply for anybody across the state who might qualify in that way. Now we're going to go back to the folks that are actually in these services. So the standard plan has the majority of the folks, about 70% of the people in Medicaid. It's doing integrated physical health, behavioral health, pharmacy, and long-term services, and has been since 2021. The people who have not been in managed care program are currently in Medicaid Direct, where only their behavioral health, intellectual disability, substance use disorder services are being managed by the LME MCOs. But soon, like I said before, some of those Medicaid Direct people will move to the tailored plan, and that is July 1st. They will get the same services that happen in Medicaid Direct, but we'll add the physical health and pharmacy. You can keep moving, Allison. Thank you. And this is a video you're welcome to watch later. We don't have the time to go through it today, but it just shows you a little bit about tailored care management and some of the services. Just a little more information. What is a tailored plan? It's a new kind of Medicaid health plan designed specifically for people with Medicaid who have mental health, severe mental health issues, substance use, intellectual disability, traumatic brain injury, to have all of their needs integrated into one health plan. If you currently are in North Carolina Medicaid Direct services, you might be moved to a tailored plan if you qualify. The services you get in Medicaid Direct are not changing. They're just moving over to the tailored plan and adding the physical health and pharmacy. Who runs tailored plan? We do, the LME MCOs. We already showed you the map that we are partners and that we have 15 counties. The other 3 in North Carolina have their own regions of the state. You have to use the LME MCO for your county. Unlike the standard plan, you don't get to choose. It's based on the county that you live in. Next. Here's the map. We are the dark blue. You can see we're kind of in the foothills of North Carolina, halfway to the mountains for the most part. Alliance is the pink one. They have most of the urban areas of North Carolina. You see they have Charlotte and Raleigh. Trillium has the most space in North Carolina. It just merged with 2 other LME MCOs, Sand Hills and East Point. And so it's now taking up the most space, but this is a very rural area of the state. So the population is really not that much more than anybody else. In fact, Alliance has the most people, I believe. And then the other one that's in the light blue is Via. And Via has the mountains as well as a few up in the northern area of the state. Next slide. So what are the benefits of the tailored plan? I've already mentioned that a little bit, but again, it's physical health pharmacy and these enhanced services for special needs for special people. So folks who have significant mental health needs, severe substance use disorders, intellectual disabilities, and traumatic brain injury. These are the folks that also might qualify for the NC Innovations waiver. So the tailored plan is where if you have the innovations waiver, you would be in a tailored plan. Also, people who are on the wait list for the innovations waiver are generally on the tailored plan. What do we also offer? Well, we offer non-emergency medical transport if you're in the tailored plan. We offer care management. We have wellness services that are in addition to just basic and health insurance services. And we also get state funds and county funds. So we are able, somewhat differently than some corporate or private health insurance companies, to offer a bit more funding because of our additional state and county funds. Next slide. Okay, it's back to Allison. Thank you.
All right. So what if you need to change health plans? This can get very tricky. So if you realize that you need a service that is only offered through the tailored plans and the LME MCOs, then you can call the enrollment broker. If there is suddenly you need a higher level service, there's the enrollment broker that's through North Carolina Medicaid, and they make the enrollment decisions. They decide which plan a member can be in. Okay. They're the only ones that make those decisions, and they do a review. The other people that can request that are providers. So if someone goes to a provider agency and they say, and the provider does an assessment and says, you need this level of care, and so you're in a standard plan, you need to move to a tailored plan, that provider can submit a request for moving. So it's called a request to move to Medicaid Direct, and it'll change names to tailored plan soon. And that is the quickest way to move to a tailored plan from a standard plan. Also, sometimes you may move your residence that puts you into another LME MCO catchment area. And so you would change health plans that way. So say you moved to Mecklenburg, but you were in Concord, then you would change from Partners to Alliance. Or any other move like that. So it may be automatic, and you'll get a letter from North Carolina Medicaid saying that you're moving and here's your new plan, and you'll get a welcome packet from your new plan. But under those conditions where you realize you need a service, you would want to call the enrollment broker to do that. There are forms online that you can fill out and not call the enrollment broker. And that is through this link. There is a fact sheet. And by the way, North Carolina Medicaid on the Department of Health and Human Services website in North Carolina has a ton of fact sheets that are very helpful for families along with this one. Okay, so we are going to move into available IDD services. So there is such a range of services and quite a few of them. So these are just broad categories that go from least clinical intervention to most clinical intervention. So of course, outpatient testing, medication management. Then there are some community-based services that we're going to go over called the 1915 I services. And anything that has like a number and a little letter, those are community-based services that are approved by Centers for Medicare and Medicaid. And what those numbers and letters represent are there are different waivers that of the Social Security Act, and that waives that part of the Social Security Act. So it gives you more access to services than what you need, and it gets you the care you need when you need it, so that you don't get worse, really. Long-term community supports is an in lieu of service. That is for age 22 and older. However, there is a lot of work going on with advocates to change that age, because not everybody, I know my daughter she got tired of going to the same school when she was 21, and she didn't want to continue those services. And Medicaid will only pay for things that aren't being paid for elsewhere. So if you're entitled to go to school, they won't let you have services during school. So anyway, we are trying to be more person-centered and move that age down for that service because it provides meaningful day supports, residential, those types of things. So it's a really great service that's being offered now. Then there's residential, getting to more intense level of service needs, mobile crisis, and then inpatient. So more about the 1915 I-State Plan Amendment. So this is so that people do not go into institutions. It's giving people home and community-based services when they need it. And this is the Intermediate Care Facility for Intellectual and Developmental Disabilities called ICF, IDD, level of care. This is not required with the new 1915I. You may be more familiar with the 1915 BC services, but the good news is that the 1915I services are not dependent on available funding from reinvestment money. There is money available for those services. So the other piece of it, though, is that there is a thicker administrative level. Like you have to go through a little bit more hoops to get those services. It may take a little bit longer, but once you get in there, there's a wonderful array of services that people who are on our wait list can access. So you'll have this comparison that'll show you the difference with the 1915 B3 services that are still out there. They're not going totally away yet, but many people have been transitioned to those I-service array. And you can see the crosswalk is they've just really combined two of them and given them a new name. And then in-home skill building is now the community living and support. That's the same service that you can get in the innovations waiver, but this is outside of the waiver, but you do have to have Medicaid to get these services. And then here is another chart that to me is very helpful to explain because 1915I services go across disabilities. And as we know, our children with IDD may also have mental health needs or other needs, chronic medical or whatever. So, and may need to transition into the community. So this shows you intellectual and other developmental disabilities, severe emotionally disturbed. SMI is severe mental illness, and substance use disorder and traumatic brain injury. So it's not disturbed, it's disturbance, I think. I can't remember. Neva, you'll have to correct me. There it is, disturbance. So here you can see what who benefits and what ages in that. And so that'll be a helpful guide for you and for others that you can help. So to get these services, you're going to need to contact your local management entity, managed care organization, and call that member and recipient services number that's on your ID card that you should be getting if you haven't already received it. And and note that some of these services are also offered for people as a state-funded service. Say there's a child under the age of 18 and they don't have Medicaid, then there may be some funding available to offer those services. And so it's always helpful to ask. And you would ask the same way by calling your LME MCO. So the process that I talked about, it involves getting an independent assessment. So the LME MCO does not determine whether they don't authorize that service. It's actually done through North Carolina Medicaid, and that takes a little bit longer, but it is an independent evaluation. Then the care plan takes some time, and then everything will be approved, and that's a little bit of time. But the turnaround is getting quicker and quicker. I mentioned long-term community supports, and this gives you a little bit more information about that. Meaningful day means what is meaningful to that individual? What is the environment that they will most thrive in? So it could be in their home, it could be in the community, it could be with a alternative living support place. It could be in a group home. It could be in a shared living arrangement with support. So that's determined based on the individual needs. And that does get authorized through the LMEMCOs. And you would just contact your care manager if you're interested in those services. There's no wrong door. You can also contact IDD providers in your area, and they can also get you started and connected. So the state funded services, the state refers to them as recipients. So when we say member and recipient services, it's for those with Medicaid and state funded services. And reminder that Medicaid does not pay for room and board. So Medicaid does not cover residential services that are residential at all. They will help with the program cost. So a lot of the residential services are state funded. This is the array of IDD state funded services for IDD and TBI. And if you want to get these services, call the LMEMCO and ask the registry or waitlist team. There is also a state-funded waiting list coordinator who can assist you. So you would ask, say that I, want a state-funded services, and then make sure they get you to the right people. All right, a little bit about the waivers. In North Carolina, we have approved the Community Alternatives Program, formerly known as CAP, and that is C for children and CAP DA for adults. This is a Medicaid home and community-based services program, which is a cost-effective alternative to for medically fragile folks who are at risk for institutionalization, so that they can get services in their home, which is much more desired. And they can remain in or return to a home and community-based setting. And this is not managed. You can get a referral from your LMEMCO, but you can also contact them directly. But you would ask, the best place to get to these programs, waiver programs, is through your LMEMCO. So for North Carolina Innovations waiver, which has quite a long wait list, and I think it's almost 8,000 folks on that wait list at this time. There's a lot of advocate activity and work with the state to reduce goals. The state goals to reduce that waiting list, to get people the services they need while they wait, and to actually reduce that waiting list. What's a way we can manage this waiver? Other states have done it. They've gotten rid of their waiting list. So there's a lot of work going on about that. But however, you do want to get on the wait list. You do want to get connected. And if you haven't done that, please do, and encourage people to do it right away. This is the broad categories of the different waiver services. And you'll know that some of these are similar to the ones that are offered through the I-services and state-funded services. But there are additional services through home modifications, vehicle modifications. There's consultative services and more with that. And it's always good to familiarize yourself with the full, like you get a handbook for innovations, and you can look at what is available. Your care manager may not say, oh, this might be good, but you can look at it knowing your child best and look at those available services and ask for it at any time. So to apply for the registry of waitlist, I talked to you before about calling the LMEMCO and asking for that registry team. You will also want to check out this roadmap that we have that can be helpful. This takes you step by step and gives you a lot of good tips about getting your psychological evaluation and adaptive functioning. And, they have to be updated over time. So you may be on the wait list for years, and then you need to update that, because if they have a spot available for you, then you want to make sure everything's updated, because it's a very time sensitive process. And other tips is asking what services are available while you wait. Periodically contact your team, your registry team, to ensure that everything's up to date, and that if there are changes that might take your status to a different level on the wait list, that's always important. And make sure to write down all your communications that you have with those registry team, and your contact may change over time. So it's always helpful to write all that information down. All right, there is a new pilot in North Carolina, but it's only in certain counties. So you can look up this information to see, but this whole program is related to addressing any social needs or barriers that people are experiencing to achieve the best health outcomes. And so, of course, we gave it an acronym, HOP. But the Healthy Opportunities is designed to assist people to get those services that they need, that you see here, with housing, food, transportation, or safety. So, and you may have heard the term social determinants of need. The state is now calling it health-related social needs, and it covers those areas. But if this is worth looking into, if you feel like that's a need.
So I briefly mentioned this earlier. We're going to talk about it in a bit more detail. This is a very important service that is being offered to folks who are in North Carolina's Medicaid Direct program now, and some that will go to the tailored plan as well. I want to tell you a little bit more about it. So next slide. Tailored care management. What is it? People who are eligible for tailored care management, which is a great deal of our folks who are in the LMEMCO plans right now, will have one selected care manager who is supported by a care team from all of their different areas that they have needs in, to provide whole person care management. It did start a while back as a soft launch, but as of July 1st, when we moved to tailored plan and we have a lot more involvement in physical health, it will become more robust at that time. It's a very important service. So next slide. The reason it's important, and the reason the state included it as something that the tailored plans and Medicaid Direct need to offer, is because unfortunately we know that folks who have severe mental illness or intellectual disability die 20 to 30 years earlier than people in the general population. And when I first heard that statistic, I thought, well, maybe that has to do with suicides or homicides or overdoses, because these are people with severe mental illness. No, the great majority of reason why most people die younger who have these disabilities is because of chronic medical issues. Often those medical issues are not well managed or diagnosed, and could be related to lifestyle risk factors or the inability to get preventive care that everyone needs to stay healthy. Allison already mentioned this, but oops, can you go back, Allison? Folks with these disabilities often have more trouble with social drivers of health as well, like homelessness, lack of support or payment. They may have more difficulty with getting health care. They're anxious. They've had trauma around health care. we know that it's difficult to get healthcare in our fragmented health system, even when you do not have any barriers to that and you do not have a disability. But when you have something like an intellectual disability or severe mental illness, it makes understanding our fragmented health system much more difficult. And then we know, unfortunately, from good data that people who have these disabilities encounter a lot of bias and stigma when they need healthcare. This creates disparities in the quality of care that is provided. We see it all the time, unfortunately, for folks who say need to go into an ER or an inpatient facility and just do not receive the same standard of care they might if they did not have these disabilities. The good news is we do have evidence, though, that for folks who have these issues, integrating their behavioral and physical health improves outcomes. And it also saves money. The way it improves outcomes is by providing more preventive interventions, by targeting these folks with care management to help them get access to care, to help improve some of the disparities and the bias and stigma. It also seems to decrease emergency department visits and hospitalizations, which is suggesting people are healthier. And of course, that saves money as well. So next slide. What do tailored care managers do? Well, they give support to the member they're assigned to get specialized medical care, behavioral health care, or whatever care needs they have, including helping them with their medicines and supplies, helping with childcare, locations, resources for home repairs, transitions, incredibly important point, helping support transitions in and out of hospitals or facilities. That's a time where things can really go wrong without having somebody checking in on you and advocating for your health. Finding housing options, scheduling your medical appointments and helping you follow up with them, providing help with transportation to get to these appointments, supporting them with chronic health issues and health needs, and then getting the prevention that I mentioned before, so key to staying healthy. So next slide. I talk a lot to our care management team, and I'm doing a lot of ongoing training with them around physical health issues. And I describe them as the conductor of a very large orchestra. They do not need to know how to play every instrument in the orchestra. They may not be a behavioral health specialist or a primary care doc or a social worker. They may have different skill sets than some of the people in the orchestra. The thing that they do, though, is they have everyone playing off the same sheet of music. So they help communicate and connect the member who's there in the middle to all of these services that they might need, individualized to their particular circumstances. So you can see, depending on the member, you may need to bring in a lot of different people into their orchestra. Next slide. This is another video. I'll just say, if you're interested, you can check this out when we get the slides to you. So thanks. Important point to make: if you or your family member is given the opportunity to have tailored care management, you can choose who you want to provide that tailored care management. We will do it at partners if you so choose. About half our members right now are receiving care management through our own staff. But you can also get care management through an agency in the community. A behavioral health agency can be certified as a care management agency. There are several of those in the area. Many people choose to do that, especially if they have a relationship with that provider already. Advanced medical homes, which are primary care practices, can also become care management agencies by getting certified with that extra plus. They become an advanced medical home plus, and they can be your home for health care management. Again, people have choice in this matter. So if you get a tailored care manager, you can choose, and you can change if you like. Next slide. And then I think it's back to you, Allison. Thank you.
All right. Okay, so we are ready for tailored plan. It's been delayed a few times, but we're finally here. So we are past this. We're so close to 7-1. So I mentioned earlier that you're probably, if you're a tailored plan, future tailored plan enrolled member for July 1st, you'll be receiving a large packet. You should get a physical handbook, member handbook. If you're on innovations, you should get that handbook as well, and some helpful information about your new integrated health plan. So some of the wonderful things available are you can use that health plan for scheduling any Medicaid service, transportation. There is now a nurse advice line that is available to answer general questions and to get advice in general, to help you decide whether you should call your primary care or you need urgent care or that type of thing. Will continue to have the behavioral health crisis line that is available 24/7, 365, and answered by licensed behavioral health clinicians or nurses. And then your pharmacy benefit manager will be also working with the plan to get those needs met. And they'll have a wide network of pharmacies to where, most likely the pharmacy you use will be in that network, that type of thing. So those lines are open. These call lines are open right now. They call it a soft launch for just to prepare if people have questions about their prescriptions after July 1st, or they have surgery scheduled that after and they're worried about any issues with that, then you can call the tailored plan and have those questions answered right now. So Healthy Opportunities for Tailored Plan will launch at the same time. If you're in those counties, you actually have to live in the Healthy Opportunity county to receive those services. So you can check on that. So you probably got your enrollment letter from North Carolina Medicaid, and then your tailored plan would have sent out that information. Do know that depending on your situation, you might be in Cap C or Cap DA, and that means you will not go to the tailored plan. You would stay in Medicaid Direct. So, just make sure you know your plan, because the LME MCOs will now manage two different plans, Medicaid Direct and the tailored plan. As a matter of fact, they'll manage a little bit more of the Medicaid Direct folks, who will still receive their medical services the same way. But tailored plan, your specialist and primary care doctors will need to be in that network. And that's just more about the timeline. So we've already gone through choosing your primary care, and those tailored plans are continuing to work with any physician provider who has decided not to be in a contract with the tailored plans. So that's work that will continue to be done. Excuse me. And I went over the information. This is more on the timeline with the call lines that you'll have through the tailored plans. Who to call when. So this depends on your health plan too. So everybody will still need to call Department of Social Services if they have Medicaid to apply or go through those other routes that we talked about. They will also need to always update their contact information through them or through that ePass. Definitely your health plan, you'll have your new Medicaid ID card that will have all those call center numbers on it, and you'll need that. For folks who are in Medicaid Direct and they have medical or pharmacy questions, or changing a primary care provider, they're going to want to call that contact center, the Medicaid contact center. The enrollment broker I mentioned, they're the only ones, they work for North Carolina Medicaid. They're the only ones that can change a health plan. And you can't change a tailored plan unless you move. You can't switch from one tailored plan to another tailored plan unless you're in that area, that catchment. But you may be able to move from a standard plan to a tailored plan, or a tailored plan to a standard plan if the enrollment broker approves that. You always have available the Medicaid ombudsman. There's one for providers too, provider ombudsman, but for members, they can call if they can't work something out with their tailored plan or their LME-MCO, or they have general questions even, you can call there as well. And they can give you advice and help you navigate the system, just like your health plan can as well. But I would encourage you to sign up for their monthly webinars if you have not attended those. It reinforces the going over what the different plans are, any new updates from Medicaid, and issues that we're seeing across the state. They also have like an advocacy role, which is great. So then you can also get their frequently asked questions. So you might want to sign up for there as well. So to stay informed, you should always subscribe to your health plan's communications. As a parent, I've always signed up for the NC Medicaid subscription for their updates and news, because they offer webinars as well. They have a community engagement team that really gives a lot of great information. There's so much more on social media now for health plans, for North Carolina Medicaid as well. And the health plans offer member portals that might make communicating with the plan easier for you, and you can have access to any screenings that your child or yourself have taken, any assessments that'll be in the portal. There are also, you can choose a primary care or change a primary care provider in that portal, that type of thing. There are many advocacy programs that are available through the health plan as well as in the community. There are advisory groups. There are lots of committees to get involved with. And that's just more details about the ombudsman and the contact information, and you can always call them as well. But one thing great I love that the state chose to have a Medicaid ombudsman. We used to only have a long-term care ombudsman, because they are compiling and tracking all the different issues. And they are giving that information to North Carolina Medicaid to alert them so that they will make changes and performance improvement to improve processes or whatever to decrease barriers. So that is a good thing that our state is doing. And then here's our contact information. And do check with your plan. I want to encourage everybody that if you don't already know about the Consumer and Family Advisory Committees, or a member advisory committee, if it's a standard plan, get involved. You don't have to join their public meetings, and you can attend those. If you're on the North Carolina Innovations waiver, there is an Innovations Waiver Stakeholder Committee. There's also a new long-term care services and supports committee. And if you're on the Registry of Unmet Needs, I encourage you to join that committee, because you can offer feedback and input into what the health plans are doing and what the state is doing as well.
Thank you guys so much for sharing that information. That was really valuable, I think, for everyone with all of these changes. There's so much going on, and I think having an opportunity to really walk through some of that is advantageous for everyone. So thank you again for taking the time to be with us tonight. Everyone, please take a look in the chat. The link was posted for posting your questions. That will also be sent out, and we want you to take an opportunity to process the information you've received tonight. And please put your questions in there in that link form, and that way we can have those prepared for you at the July session. So thank you again, everyone, for your time. Have a wonderful night.
Thank you all.
Thank you all.
Thank you so much for being with us tonight, ladies, and we look forward
Thank
to
you
some
for
more question
having
and
us.
answer in July.